Good morning, everybody. For those of you that don't know me, I'm Julie with CompassionCare Hospice. I'm the community education nurse, and we come in and do classes once a month. Today we're going to talk about heart health, and especially heart health for women. For those of you that don't know, today is National Wear Red Day, and that is an initiative by the American Heart Association to bring education, research to heart health, heart disease. Unfortunately, heart disease is still the #1 cause of death in our country for both men and women. More women are affected, about 5 times more women than breast cancer. So it's very important that we talk about heart disease. What is it? How can we prevent it? What puts us at risk for it? So that's what we're going to do a little bit today. We're just going to do a very short class. I have a full 1-hour class on this, so if you're interested, I brought the handouts for that. It goes a little bit more in depth. Today we're just going to hit some of the highlights, okay? So we don't think about our hearts very often, do we? It's in there, it's beating, it's doing its thing. The heart's a pretty amazing organ. It carries blood and oxygen and nutrients to our body, but we don't give it much thought because it just works automatically, unless we have a problem. So I thought this was interesting. Here are some statistics for you. The average person's heart beats between 60 and 80 times per minute. So if we use that 80 times per minute, our heart beats at 4,800 times in an hour. That means that it beats 115,000 times per day. So can you guess the number per year? How many times our heart beats per year? 42 million plus. That's per year. Now I'm 46. I tried in my head to do the math for that. Can't even do it. That's a huge number of times that our heart is just doing what it needs to do. So heart disease, we want to talk about it. We want to think about it. We want to protect our hearts. Oftentimes I'll hear from people, well, I already have heart disease or I have high blood pressure. You know, there's nothing I can do. Even the smallest changes that we can make in getting healthy can have a significant impact on our heart health. So that's why we want to talk about that today, okay? What is heart disease? We hear that term and a lot of people don't know what that means. Typically, we're talking about coronary artery disease or coronary heart disease, you might hear it called. And this is where the tubes that go to your heart, the arteries that carry blood, become blocked and narrowed by things like fatty deposits and plaque. And when they become narrowed, it's just like the drain in your sink. You know, sometimes it gets clogged with our hair, other gunk gets down in there and the water starts going down slower and slower. The same thing happens to our heart. It starts getting clogged up. Now when our sink gets clogged, what do? We can pour some Drano down there, or maybe we call the Roto-Rooter man and he comes in and he cleans it out. We can't exactly do that with our heart. So we want to make sure that we understand what causes those things to happen. So how does that plaque get in there? It's caused by fat and cholesterol. High blood pressure can lead to the plaque building up, smoking, and having diabetes, having too much sugar in our blood. Those things can all contribute to plaque building up in our arteries, making those tubes narrower and narrower. The smaller they get, the harder it is for the blood to get through to the heart. If that blood can't get through and can't reach the heart, part of the heart dies. That's what we call a heart attack. So it's very important that that blood can get through, and if we're having any signs or symptoms of a heart attack, we want to make sure that we get help right away. So let's go to our next page. As we get older, our risk for heart disease does increase. And there are some things, some risk factors that we can modify and some that we can't. So some of the ones that we can't modify is obviously as we get older, we can't help our age, right? We're all getting older every day. Our sex affects it. Unfortunately, women are at more risk for heart disease than men. Some has to do with our hormones, our estrogen. After we go through menopause, we're at greater risk. So we can't change that. We can't change our age. Heredity also plays a role. So if you have family members, especially if you have a mother or a sister who had heart disease before the age of 65, or if you have a father or brother who had heart disease before the age of 55, you're at greater risk for developing heart disease. So those things we can't affect, right? We can't change our age or our sex, and we can't change our family history, but it's important to know those things and make sure you discuss that with your doctor, because those are risk factors that would put you at higher risk for developing heart disease. Some of the risk factors that we can modify, and those are what we want to talk about today, are things like smoking, having high blood pressure. High blood pressure can lead to heart disease, high cholesterol, being overweight, being physically inactive. Physical activity and exercise is very important. And then if we have diabetes, we want to make sure that we're monitoring it and it's controlled, because uncontrolled diabetes, where we have all that excess sugar in our blood, is going to make us at higher risk for heart disease. So if we have heart disease and we have this narrowing of our arteries and this plaque buildup, we're more at risk for a heart attack. So we want to talk a little bit about what are the signs and symptoms of having a heart attack, because if we're having any signs and symptoms, it's important that we get help right away. The sooner we get help, the better our chances of survival and recovery. So who can tell me some of the common symptoms of a heart attack? I think we've all heard of some of them. Can you guys think of any? You had heavy pressure on your chest. Yes. You felt like an elephant was sitting on your chest. You know what? That's a very common description. Oftentimes people will think we're going to have pain. And some people do experience chest pain, but that's a very common description, is feeling pressure or heaviness on your chest, like somebody's sitting on your chest. So that description of an elephant sitting on your chest is very common. Others could be pain in our upper body. Oftentimes we'll hear pain radiating down an arm, especially the left arm, pain in the jaw, pain in our upper abdomen, our stomach area, or the back can be very common. Feeling pressure, feeling short of breath. Even if you're resting, you may be sitting in your chair and all of a sudden you're having difficulty breathing. Another one that's less common and people aren't aware of is feeling sick to your stomach. Feeling nauseous or vomiting, and this one is much more common in women than it is in men. Feeling lightheaded or dizzy, breaking out in a cold sweat, where you're sweaty and you're kind of clammy and damp, but you're not hot. Those are more common in women. And oftentimes, as you said, you don't have all the symptoms. Not everybody's going to have all of the symptoms. And some can be very mild, and it's very common for women to have milder symptoms than men. Sometimes a heart attack can start suddenly, it comes on all at once, and other times it builds up over time, where you might wake up feeling that pressure in your chest and it gets more significant over a couple of days. Oftentimes women will find out that they've had a heart attack and they don't even know it. We call it a silent heart attack or silent ischemia. And they don't even realize it because the symptoms have been so mild, and they find out because maybe the doctors check them for something else and they can see elevated cardiac enzymes, or other tests have been run, and we find out that there's been heart damage from a heart attack. So I always tell people, you know your body best, right? We all have maybe common aches and pains. You know, you get to a certain age where we might have some arthritis, we might have chronic back pain when we get up, we're stiff in the morning. Those things, you know your body. If you ever are experiencing symptoms that are unusual for you, it is so important that you let someone know. Here at the community, you have a wonderful nurse. Many of you have a home health or a hospice nurse, but you want to let someone know so that you can get medical attention right away if you're having any of those symptoms, anything that's out of the ordinary for you. Another one that's very common for women especially is extreme tiredness, extreme fatigue. Almost like when you have the flu, some women will describe flu-like symptoms. They just feel achy and so tired.
I had 3 heart attacks. Each time I thought I was having heart.
So you had symptoms of indigestion, symptoms of heartburn, and that actually turned out to be a heart attack. So yeah, when you're having something that's out of the ordinary for you, it's so important that you let somebody know so that we can get the medical attention that we need. And that leads me to the next point. We don't want to wait, but women notoriously wait to seek help. Why do you think that is? Why do you think women don't get help? Any ideas? I think one is that we spend our whole lives being nurturers to other people, and so we're always taking care of someone else, and we tend to not take the best care of ourselves. I think another one is sometimes we're embarrassed, and we think, oh, we don't want to make a fuss. No, don't call the ambulance. We'll be embarrassed. We don't want to make a fuss. It's fine. And I think we're pretty stubborn too. Sometimes we tell ourselves, well, I can't be having a heart attack. I'm not going to have a heart attack. And we think we can will it away. So women notoriously don't call for help. So it's very, very important. If you're having those symptoms like these two lovely ladies here, you got the help that you needed, and that's why you're with us today. And I'm so glad. So we want to make sure if we are having symptoms of a heart attack, going by ambulance is certainly the most recommended. Okay, we want to make sure that we have medical personnel who can monitor our heart. They can see what's going on. They hook us up to machines called EKGs, and they can get a good picture. They can also start life-saving procedures right away. There's medications that are designed to dissolve clots that they can administer, and the quicker we can get medical help, the better our outcome is going to be. So I always say that if the community here is calling 911 and the paramedics come and they are recommending that you do go to get help, that you follow their advice. Okay, sometimes we can be stubborn and say, no, I'll just wait till tomorrow. If they're recommending it, we should go and get checked out. So what can we do? What are some of the things we can do to either avoid heart disease, or if we have it already, to prevent it from getting worse? We want to know our numbers. Okay, so we're talking about our blood pressure and our cholesterol numbers. Those are important numbers to know. Most of us, when we go to the doctor or our nurse comes in, they put the cuff on our arm and it squeezes really tight. They take our blood pressure. That's a pretty important number. That gives the doctor a really good picture about what's going on in your body. Having high blood pressure is one of the greatest risk factors for heart disease and for stroke, as well as many other cardiovascular conditions. So it's so important that our blood pressure is kept at a good level. We get those numbers, and the doctor might say your blood pressure is 120/80. That actually, what they're doing is they're reading the force that it takes for your heart to push the blood out into your system. And then that second number is actually when your heart is resting between beats, the force of the blood. And so when we have high blood pressure, it can damage our arteries. It causes them to lose some elasticity and harden, makes it harder for the blood to flow. And you can imagine if that blood's flowing with an extreme force, if we have those deposits, that plaque and cholesterol built up, it can cause that to break loose, and then we have a clot that's traveling. So that's why our doctors are typically very concerned if we have high blood pressure, and we want to make sure we're taking steps to manage that. Same thing with our cholesterol. Those numbers give the doctor a good idea of what's going on in your body, and they may recommend some changes, some dietary and lifestyle changes, as well as cholesterol medication that can help lower those numbers. We want to eat healthy, and we talk about this, those of you that were in my nutrition class, we've talked about eating healthy. We want to eat things that are good for our heart. We want to stay away from high cholesterol foods, things that are high in saturated fats. So I just did this class yesterday and we were laughing because basically anything that tastes really good and yummy, ice cream, donuts, cake and cookies, those are all pretty high in fat. So I always say we don't want to deprive ourselves completely, right? We deserve a little treat, but we want to eat those things in moderation. And then the heart healthy foods that we want to add to our diet are things that are high in fiber. When we consume a lot of fiber, it helps to kind of eat away at those cholesterol pieces and help get them out of our body, so it lowers our cholesterol. So whole grains, whole grain breads, whole wheat breads, high fiber fruits and vegetables are so good for us. And then we want to consume good fats. So we hear a lot about fat being bad for us, but there are good fats. So things that are high in good fats are salmon. Omega-3 fatty acids are good for our heart. Things like avocados, they have a high fat content, but it's the good kind of fat. Olive oil, that's really big right now. We hear a lot about the Mediterranean diet. They eat a lot of fish, a lot of grains, a lot of fruits and vegetables, and a lot of olive oil. So olive oil is good for our hearts. We want to eat healthy. If we drink, we want to drink in moderation. For women, they say no more than 1 glass a day or 1 drink a day. And what that equates to is 1 5-ounce glass of wine or maybe 1 beer. For men, it's no more than 2 a day. Okay, so we hear that red wine is good for our heart, but we want to drink it in moderation. We want to get active. And I know sometimes I talk to groups like this and it gets harder as we get older to be active. We might not be able to get up and run or jog or walk a long distance, but any amount of physical activity that you can do is so good for your heart. So I know Barbara does exercise classes, you do chair exercises. Even if we're just doing exercises like this and moving our upper body, any amount of exercise is good for us. We want to be as active as we can. If you're able to walk with your walker, walk around your beautiful community here. If it's a beautiful sunny day like it is today, get some fresh air, do a little bit of walking, okay?
I go upstairs.
You go upstairs?
When I'm on the 2nd floor,
Mm-hmm.
but I walk around, and I'll come back and I'm tired.
Yes, it does wear you out, doesn't it? That's right.
Yeah,
So
but
as much activity as you can tolerate. We want to watch our weight. If we're overweight, even losing as little bit as 10 pounds can have a significant impact, especially on our heart. So sometimes we think, well, I have 100 pounds to lose. That's never going to happen. Just small increments, okay? Even making small, minor changes can have a major impact on our health. If we're a smoker, we want to think about quitting smoking. Smoking is a high risk factor for heart disease, stroke, as well as many other conditions like lung disease. We want to manage our stress. How many of you were here for my stress management class? I know a few of you. Stress takes a terrible toll on our body when we're under chronic stress. It causes our heart rate to speed up. It causes our blood pressure to go up. Just yesterday at my class, we had a good example. Someone talked about sitting in the doctor's office and waiting. They come and they take your blood pressure and they say, your blood pressure is sky high. You go, yeah, because I've been sitting in your waiting room for 30 minutes. And then they take it again towards the end of your appointment and it tends to come down. When we're under stressful situations, our blood pressure goes up, our heart rate speeds up. Those things all have an impact. And when they last a long time, it's so important that we find ways to lower our stress level. Can you guys remember a couple of the things we talked about from stress management? We talked about deep breathing, the importance of training your body to relax. So breathing in through your nose, out through your mouth, filling our lungs. We tend to breathe very shallowly, just at the top of our lungs. We want to get that air all the way into our lungs, and we want to get that bad air out and the good fresh oxygen in. It's very relaxing, it's very therapeutic. And if you do about 5 minutes every day, a great time to do it is right before you go to bed. It's very relaxing. People that were having difficulty falling asleep say when they start practicing that, they just drift off to sleep. Then when you're under high stress, your body's trained and you take just a deep breath or two in, and right away your blood pressure comes down, your heart rate slows down, some of those stress hormones like adrenaline start to lower. So managing our stress is very important. Deep breathing. How many of you are doing those adult coloring books? Those are very popular right now. They have beautiful kaleidoscopic pictures, very geometric, and you color them. Very relaxing. I just tried that for Christmas. We got a coloring book and I thought it might frustrate me. I might have to throw it out the window, but I didn't. It was very relaxing. It's very hard to be stressed and worried when you're just focusing and you're coloring. Having that time to focus. It's a little bit like meditation. We call it mindfulness. So learning how to manage our stress is very important. And then if we have diabetes or pre-diabetes, it's very important that we control our blood sugars. We want to see those numbers stay stable and not rise and fall, okay? Because that excess sugar in our blood causes many problems, and heart disease can be one of them. So on your handout here, this one talks about women's heart health, and this is something that you can take back to your house with you and fill out. It actually on this side goes over the risk factors. So we talked about those things. What is my age? What is my family history of heart disease? So this is going to give you a clear picture of how many of those risk factors you have. And then on the other side, it has again those signs and symptoms of a heart attack and what to do in case you think you're experiencing that. So this is yours to keep. And then this other form, this talks about healthy food choices when you're eating out. Because you guys here are really lucky, you don't have to cook your meals anymore. You get to eat out in the dining room every day. So basically, this gives you some healthy food choices, things like choosing the baked chicken or fish over fried, having a potato instead of French fries, smaller portions of dessert. So this is just another handout for you that might make it a little bit easier to make some good food choices. Okay, and those are yours to keep. Do you guys have any questions for me? Do you have any questions?
I'm getting enough.
How about for our two ladies who have experienced heart attack? Do you have anything you'd like to add for the group?
Well, I've had open heart surgery. I have a pacemaker and I have forceps. I'm definitely a cardiac patient,
Yes.
but I can't control the food here. Give us fried green beans or something. I don't need it.
And that's good. What she's saying is sometimes it's hard because your meals are prepared for you. And again, that's where this handout might be helpful because it gives some suggestions. I know in most communities you do have kind of an anytime menu so that if the menu choice for the day is something that you can't eat or you can't tolerate well or isn't on your diet, you can choose some other things. So this may give some suggestions for foods to choose. You know, if fried fish is on the menu, what would be some other options for you? And it talks about things, you know, we've talked before when we talk nutrition. Dairy is so good for us and so healthy, but we want to choose low-fat options. So low-fat or non-fat milk, sour cream, low-fat yogurts, things like that. And so this might give you some tips on things that you can add into your apartment when you're out shopping or things that you can ask for in the dining room as well. Anybody else have anything they'd like to share? No? You got a whole lot already. Well, and again, this was just kind of a brief rundown on heart health and especially heart health for women. So I do have the full presentation if anybody would like to pick that up. I have some copies over here and I'll be available if you have any questions after that you'd like to ask one-on-one. Okay? Thank you guys so much. Thanks for having me again.